the physician, when the provider starts barking in your ear about something you did or did not do, or the patient did or did not do, how are you going to diffuse that situation? When you have a patient that doesn't agree with an intervention that you want to perform, or doesn't like the medication that you're giving, and they're screaming so loud that the veins are popping out of their neck, how do you diffuse that situation? When a provider asks you a question and you don't know the answer, and you get ridiculed for not knowing what you need to know, how do you adjust? The answer for everyone is different, but the bottom line is you have to have your own answer. I hate to say it, but being the movie buff that I am, it's sort of like what was it? It was the movie with Tom Hanks. Was it A League of Their Own? I think it was A League of Their Own. And he quoted, "There's no crying in baseball." Well, there's no crying in nursing. You need to figure it out. You need to suck it up. You need to you need to deal with it. Just as my partner in crime, Katie Duke, would say, you need to deal with it. Now, dealing with it doesn't mean you ignore it. Dealing with it doesn't mean that you start screaming back at them. Dealing with it means that you figure out a way to, what's the word I want to use? I don't want to say make it stop, but your way of diffusing it, your way of solving the problem. You're going to have so many moments where the emotional spectrum will go from one end to the other in a single solitary day. In fact, you may visit a handful of emotions just with one patient on one encounter. And it's your job to manage those emotions appropriately, because in the end, we're professionals. It's our job to advocate for our patients. We're there to take care of them, be there for them, and to help rehabilitate them through some of the worst experiences they're ever going to have. So they're going to be that wall that they need to lean on. And if you don't have a thick set of skin and you don't have a control of your emotions, you're not going to be able to perform your job the way you need to. So you need a thick set of skin because you're going to need it to survive, not only with bad coworkers, but the other badness that's out there. But you also need it to maintain your sanity. You also need it to care for your patients in the most ideal and most appropriate manner. So when I say that nursing is not for everyone, this is the part that most people can't get or don't grasp or have a problem solving. They have the book knowledge, they can take the tests, they can perform the skills, they have great kinesthetic awareness, they are the best at, dropping the NGs and starting the IVs and whatever the skill may be, but for some reason they're an emotional wreck. Well, having your emotions in control, in check, is equally as important as being able to start an IV. So it's your job to figure out how to balance all of that as a nurse.